Welcome to the MRCSBites session on Lower Limb Anatomy and Pathology, OSCE Station 1. Today, we'll dive into this topic and explore the common questions tested during the MRCS Part B exam. For more information and full course, please visit MRCSBites.com. Question 1. Name the nerves that arise from the lumbosacral plexus. The lumbosacral plexus is a network of nerves that supplies the lower limbs and parts of the pelvis. Key nerves arising from the lumbosacral plexus include femoral nerve, supplies the anterior compartment of the thigh and is involved in knee extension. Obturator nerve, innervates the medial compartment of the thigh, contributing to hip adduction. Sciatic nerve, the largest nerve in the body, it branches into the tibial and common fibular, peroneal, nerves, supplying the posterior compartment of the thigh and the entire lower leg and foot. Superior gluteal nerve, innervates the gluteus medius, gluteus minimus, and tensor fasciae lati muscles. Inferior gluteal nerve, supplies the gluteus maximus muscle. Pudendal nerve, provides sensory and motor innervation to the perineum and external genitalia. Question 2. Name the extracapsular ligaments of the hip joint and their attachments. The extracapsular ligaments of the hip joint are important for stabilizing the joint. They are iliofemoral ligament, originates from the anterior inferior iliac spine, AIIS, and the acetabular rim, and attaches to the intertrochanteric line of the femur. It prevents hyperextension of the hip joint. Pubofemoral ligament, arises from the superior part of the pubic bone and attaches to the inferior part of the femoral neck. It limits excessive abduction and extension of the hip joint. Ischiofemoral ligament, begins from the ischial part of the acetabulum and spirals to attach to the greater trochanter of the femur. It helps limit internal rotation and adduction of the hip joint. Question 3. Name the structures which attach to the greater trochanter of the femur. The greater trochanter of the femur serves as the attachment site for several important muscles: gluteus medius, gluteus minimus, piriformis, obturator, internus, superior and inferior gemelli. Question 4. Name the structures which attach to the lesser trochanter of the femur. The lesser trochanter of the femur is a bony prominence on the femur where several structures attach. The primary structure that attaches to the lesser trochanter is the iliopsoas muscle. The iliopsoas muscle is a combination of the iliacus and psoas major muscles, and it is the main flexor of the hip joint. Question 5. Name the muscles that attach to the linea aspera. The linea aspera of the femur serves as an attachment site for several muscles of the thigh. These include vastus lateralis, vastus medialis, adductor longus, adductor brevis, adductor magnus, biceps femoris. Question 6. Name the structures that attach to the anterior superior iliac spine. The structures that attach to the anterior superior iliac spine, ASIS, include inguinal ligament, sartorius muscle, tensor fasciae lati muscle. Question 6. Name the structures that attach to the anterior inferior iliac spine. The structures that attach to the anterior inferior iliac spine include rectus femoris muscle, one of the quadriceps muscles originating from the anterior inferior iliac spine and playing a key role in hip flexion and knee extension. Iliofemoral ligament, part of the hip joint capsule, originating from the AIIS and providing stability to the hip joint.